Good morning, everybody. Welcome to a day in the life of a PGY1 pharmacy resident in her cardiology rotation. Today, for some reason, I woke up earlier than my alarm, so I just got up from bed, brushed my teeth, did my hair in my 2 French braids to a ponytail, and then I got dressed in my scrubs. I then left the apartment and grabbed a few of these bags filled with gifts for the pediatric outpatient holiday family sponsorship that I'm in charge of coordinating. I then walk into work, drop the bags off, and today I am getting breakfast from the cafeteria. I got a John Denver breakfast sandwich, which is really good and quite affordable as well. After eating, I walk up to the 3rd floor and sit in the pharmacist room to begin my shift at 7 a.m. On this shift, we cover the heart center and the cardiovascular ICU patients, which ends up being around 50 to 60 patients, give or take. As it's the final days of this rotation, and I am about halfway through the residency year, I began taking on the entire floor this week, or I guess both floors. I will say that this shift is in charge of covering the meds to beds pharmacist from 7 to 9 in the morning until they come in at 9, but my preceptor took on that role so that I could get more cardiology experience. The first thing I do when I log in is a quick review of my patients to determine their priority and the order that I should work on things. I then began working through my patients, and a few of the things that I've done include dosing vancomycin for patients on intermittent hemodialysis or continuous renal replacement therapy, assess potential causes of ICU delirium and recommend therapy adjustments to minimize that, and dose warfarin and provide education to new start patients. Then around 1:20 p.m. today, I took my lunch, and I will say that's a little later than usual. I went down to the cafeteria and got some pasta. Then after lunch, I go back up to the floor and continue finishing up all of my consults and as many informals as time allows. At the end of the day today, I also had my final topic discussion on this rotation, which was on heart failure guideline-directed medical therapy. My shift ends at 5:30 p.m., so I head back to the pharmacy at that time to gather my belongings and head home. We did have a new pharmacy supervisor who started today and brought donuts for everyone, so I went ahead and grabbed one of those on my way out. And I usually don't do this, but I was really craving Hawaiian food, so I drove to a nearby place on the way home from work to pick up some food. I got spicy volcanic beef is what it was called, rice, and the mac salad, which all was very delicious. I then had the donut that I picked up for my dessert. I took a shower, put lotion on my face, and then did some work before it was time to go to bed around 10 p.m. Thank you for watching. I hope you enjoyed it, and I'll see you next Sunday for another video. Bye!